Hi, everyone. I am Jessica Messersmith. I am the chair-elect for the American Academy of Audiology Foundation, and I'm joined by Ryan McCreery. And I'm going to let Ryan introduce himself with all of the titles he holds at Boys Town.
Hi, my name is Ryan McCreery. I'm the Vice President of Research for Boys Town National Research Hospital in Omaha, Nebraska. I'm also the Director of the Audibility, Perception, and Cognition Laboratory at Boys Town, and I've been an audiologist and a member of AAA since 2001.
Thanks, Ryan. So today I have a couple of questions for you, and really I'm hoping that we can get a good understanding of why and how new research is so critically important for the profession, and why donations of support to the Academy through the foundation are really critical for supporting the researchers in our field and the work that they're doing. So my first question for you is, why should Academy members support new research initiatives that are supported by the Academy and the foundation?
That's a really good question. And as a researcher and also as a supporter of the American Academy of Audiology Foundation, this is a question that's near and dear to my heart. So one of the unique things about the funds that are used and developed for research by the foundation, as you know, is that we use them to directly support audiologists, either student audiologists who are in their training to become researchers or early career scientists in our field. And it's one of the most direct ways that a member of the Academy can support research in audiology. And it's so important for audiology to have its own research base and not to have to rely on other related professions to develop the research questions of interest that are important to us. We are the experts in hearing imbalance as audiologists. And so it's so critical for us to be the ones who are engaged in these questions, because we have an understanding that's going to allow those research questions to help our patients, to help our practice, and to help us get reimbursed for the services that we provide, because so much of reimbursement and what is tied to our practices is based on evidence. And if we can't generate the evidence that we need to support our public policy agenda, our reimbursement rates, it becomes really difficult to do that if we don't have that foundational support for research.
That's a really great point, Ryan. And that's meaningful to think of that in that way, right? That this research that's so critical for audiologists to be doing it, because it is going to feed into that clinical audiologist's ability to practice and do what they do every day. So one of the efforts we're trying to do is really align the foundation and the research initiatives that we're supporting, align that with the goals and objectives of the Academy and the research branch of the Academy. So can you tell me about the Academy's most pressing needs to support evidence regarding the value of hearing screening and evidence about patient safety and direct access to audiology services?
Yeah, so if you were going to ask me to sort of rank important public policy issues that are facing audiology, given all the changes in service delivery, over-the-counter hearing aids, audiologists are challenged more than ever to sort of demonstrate that what we do has value to our patients and to the healthcare system. And in order to do that, we need evidence to show that audiology, above all else, is the best way to support optimal outcomes for people with hearing imbalance problems. And so the examples that you mentioned, so hearing screening for adults is going to be an increasing and pressing need for the profession as the population gets older. Successful aging is going to become something that we're very familiar with, and that's going to be really good for audiology. But in order for us to be part of that process and that trend in healthcare, we need to show the importance of not just screening, because we all know that hearing screening for adults is important so that adults know if they have hearing loss and what to do about it. But I think we need evidence to show that early screening, during the 50s and not waiting until people have a significant hearing loss to get hearing screening is going to be so important. But in order to move that forward, we really have to provide evidence that it's worthwhile. We've all heard the headlines recently about healthcare screenings, screenings for breast cancer, for prostate cancer, that used to be part of routine care that are no longer recommended because they're not cost effective or not sensitive enough. So it's becoming increasingly challenging, even for important things like hearing loss, to make sure that we have the evidence to support the need and the cost effectiveness of these screening programs. And really the only way to do that is to develop those ourselves as audiologists and scientists who work with audiologists.
That's great, Ryan. Those really are two priority areas for the Academy and two areas that we as a foundation want to support through the research grants that we provide. So, Ryan, this video is part of our day of giving. So do you have a final pitch to the people out there watching of why they should donate to the foundation today?
Yeah, I think everyone should donate to the foundation because it really will ensure the future of audiology. If you look at the people who've received research grant awards from the foundation in years past, they're some of the most successful scientists that we have in our field. They've gone on to get large grants from the National Institutes of Health, the Department of Defense, and they're really leading the field in terms of our evidence. And so if you are donating to the profession, you're helping the future and you're helping us to push forward these important initiatives that will ensure the future viability and success of our whole profession. So I would urge all of my colleagues to please support the foundation on this day of giving. It will have an enormous direct impact on the field.
Thank you so much, Ryan. All of you, go to our social media pages, go to the webpage, make a donation. Every dollar that you donate will be going to supporting research in the Academy, to those individual researchers, to those clinicians who are doing this really important work. So thanks again, Ryan, for joining us, and I hope you have a great rest of your day.
Thank you. I appreciate it.